My name's Peter Nash. I'm a Professor of Rheumatology, School of Medicine, Griffith University, beautiful downtown Brisbane in Australia, reporting for RheumNow from EULAR Copenhagen 2022. Yesterday was the recommendations day. I was involved in the task force for updating the recommendations for rheumatoid arthritis for EULAR, and I'll summarise a very, very nice presentation by Joseph Smolin. They started off with the usual conventional synthetic DMARDs. The controversial area was the recommendation to continue low-dose prednisone as a recommendation, in brackets, short-lived. This is in variance with the ACR, which purposely left that off. And I must say I didn't agree with it, and I voted against it because, or at least I abstained, because it's not about the problem is getting people off those last few milligrams of prednisone, and once they've got the bottle in the hand, they then self-medicate, and it's a major issue. So even though the recommendation is short-lived, if you look into some of the studies, something like 20 to 38% are long-term low dose, and that's not good for people. So what really changed, he showed some evidence that methotrexate plus glucocorticoids is not inferior to methotrexate with a biologic DMARD. Recommendation 9, the alteration is that you could commence a biologic when conventional synthetics failed, which is quite reasonable, but then they said, or a JAK inhibitor, but the change was you can consider a JAK inhibitor, but you have to take risk factors into account, and they listed the risk factors: over 65 smokers, the cardiovascular risk factors, malignancy risk factors, and thromboembolic disease risk factors. So on they went, and they talked about the 5 overarching principles. The recommendation 6 to 12 didn't change. He talked about combination conventional synthetic DMARDs plus your biologic, and again non-evidence-based switching and really non-evidence-based tapering, all important. Steroids first, of course. So there were some changes, but in essence the change to the JAK and the continuing recommendation for low-dose prednisone were the major things in the updated guidelines. Back to JAK, back to RheumNow, more presentations to follow.